I'm so happy today to have a couple folks from the Alzheimer's Association here, Janis and Hudson. I almost screwed up your name a couple minutes ago, like several times. But thanks for coming, both of
Yeah,
you.
of course.
Just
Yeah, I
think of the
really
river.
appreciate being here.
And
Yeah, very grateful.
Kristen's
That
here to co-host,
Thanks,
and I
Andy.
always enjoy you being here co-hosting.
Thanks
So
for asking me.
yeah, um, yeah, we're going to talk about some new research and whatnot, some exciting developments, I guess you'd say. I just wanted to get real quick, like, tell me about your roles with the organization.
Sure. I'm actually a volunteer with the organization. I've been volunteering for probably 14 years. I've done the Walk to End Walk to End Alzheimer's as a team captain, but my passion's really about education. So I've been a community educator for 11 years. I do it whether it's virtually or in the community, probably 10 different classes. My whole goal is to reach people, help people living with the disease, and caregivers. I've also done support groups, I've done advocacy, so I'm kind of all in with the Alzheimer's Association.
Awesome.
My mom had it, and that's what
Mm.
drew me here.
I'm
Okay.
sorry.
Thank you.
And I can't speak highly enough about Janice. And if you think about 14 years, so Janice pretty much single-handedly, in terms of the impact that she has in the community here, reaches thousands of people each year. So multiply that by the number of years she's been around, and she's really affected
Thank you.
a lot of lives here.
Thank you.
That's great.
Yeah, and so my role is I lead marketing communications for the Oregon and Southwest Washington chapter of our organization. I've been with this organization for over 5 years now, and am just very, very passionate about the work that we do. I've got a family connection as well, my grandmother. And so, really what I want to do is raise awareness and make sure people know that, we are talking about these things. There's great work happening there, resources, and that we're here, especially locally.
For sure, yeah.
Yeah.
Yeah, I was gonna say a little bit of context real quick. The timing of this was like serendipitous, probably the wrong word, but this year my mom has like on the onset of Alzheimer's. My sister texted me yesterday and said it's dementia with Alzheimer's probable.
Jeez, I'm so sorry, Andy.
Yeah, I mean
Wow.
I appreciate it.
I know you were seeing something and you weren't really sure what.
Yeah, well, I think they're still doing all these tests. She's done a bunch of cognitive tests and stuff. But yeah, so the timing was like, I was like, oh, that's really interesting. I would love to help, spread awareness about this stuff. And uh, yeah, I was gonna. We were talking about this a second ago. I wanted to start because there's like some brand new research, but in order to kind of dig into that, you were saying we should kind of go over the high level stuff of
Absolutely. Yeah, if we could.
Alzheimer's and
Yep.
dementia and kind of differentiate those. And
Just starting there, just because I think there's just a lot, there's still a lot of confusion around this, and there's stigma, and it's a difficult conversation. And so anyway, just to really look at this simply is what is, Alzheimer's, and what is the difference between Alzheimer's and dementia and all that. So dementia is an umbrella term that captures a number of different types of dementia. Alzheimer's being the most common form of dementia. Most dementia cases are Alzheimer's.
And dementia
Um,
just means brain death, right?
Loss of cognitive functioning significant enough to impact everyday living.
Okay.
and
I don't
so
think enough people know
that's
that.
the Alzheimer's definition, or that's
That's
dementia.
the
That's dementia.
dementia.
Gotcha. Okay.
Very
Alzheimer's
general.
is a
Yeah.
subset of dementia.
Alzheimer's is a specific progressive dementia disease.
Is all dementia progressive?
All dementia diseases are. Dementia's just symptoms. It's that
Huh.
confusion,
Okay.
behavior change.
So it's not a diagnosis.
It's more of a state.
It's
State
a
of the
collection
brain
of
or something.
symptoms.
Yeah.
So many different things can cause dementia-like symptoms.
like a concussion or something.
Things that are treatable and curable.
Okay.
So we talked a little bit where it can be things like dehydration or
Yeah.
urinary tract infections, or very serious things
Okay.
like a brain tumor or thyroid abnormalities, stroke, things like that. They can all kind of look like dementia, even medication interactions and side effects.
Sure.
That's why you'll always hear us advocate get to the doctor, find out what's causing this.
Right.
It may be a progressive dementia disease, of which Alzheimer's is the most common, or it could be something else.
Symptoms of something else
Yeah.
that maybe you also need to address that you could fix.
Yes, possibly.
Oh, well said.
Sorry.
Great job.
Yeah, great job.
Yeah, and so just to look at things a little bit locally, right? Some of these things are a little bit, they stand out. They're shocking. 1 in 10 older adults, and that's adults above the age of 65, have an Alzheimer's or living with Alzheimer's.
Is this a new phenomenon? Is it because I hear about Alzheimer's more than I ever have.
Mm.
And that could just be an anecdotal thing and it could just be me, but it seems like, is it like autism where we're trying to decide, is this something on the rise? Is it just something we know more about? And so it's more easily diagnosable? Is it a little bit of both? Do we know?
I think it's a fair comparison because it is going to be a combination of a number of these things. Heightened awareness, less stigma. People are living longer. And so
Yeah.
people care about, aging well. There's a lot more conversations just about healthy aging and wellness and, how we take care of ourselves and the things that we can do now to make sure that we're set up in the future. Is there anything that you want to add to that?
Well, I guess I would just say, back in maybe our grandparents' generation, it was, hardening of the arteries or senility. So we have a name for it now.
Mm-hmm.
But I do think this idea of we're just living a lot longer. And for the most part, this is a disease. The greatest risk factor is age. So it's something that comes on later in life for the most part. And so I think that in the past, people, were succumbing maybe to other things before they would get to that point. But as living longer now, I think it seems much more prevalent.
I think there's an assumption that it's like prostate cancer for men. Like if you live long enough, you just get Alzheimer's. Is that true?
It's completely false. That is false. So
And a very common assumption.
it
I
is.
hear that all
Thank
the time.
you for
I do
raising
too,
that.
yeah.
Yeah, no, it's not. I mean,
I just learned that it's, I just learned that it's not. But I think the assumption is always like, well, they're getting older, they're forgetting things.
there's normal aging. We all forget. There are, just like our bodies slow down, maybe it's harder to get up from the floor. You can't run like you used to. Our brains slow down too. So our brain, we'll tend to forget a few things. We have a great class about this because this is normal aging, but this is indicative of something deeper. And so, if this was normal aging, everyone would get it. And we know that's not the case. I always look at my own family. My mom, who had both Alzheimer's and vascular dementia, we all thought she was going to be just like my grandma. My grandmother, my mom's mom, lived to 104.
Wow.
She was sharp as a tack
Yeah.
to her last day on earth. So not everybody gets this disease.
Even if it is in a genetic line, like in your family, there's no.
It's not predetermined.
The genetics are there's a lot of different genetic things at play.
Yeah,
So
yeah.
there are deterministic genes, but they're very rare for Alzheimer's.
Okay.
If you have the gene, you're going to get the disease. Again, quite rare. More common is what they call a risk gene. And with that gene, if you have the gene, it increases your risk, but it doesn't guarantee that
Okay.
you will get the disease.
One of those common genes that that people often think of as the ApoE4.
Right.
And it's actually interesting because there's some recent research just came out about things that you can do to reduce your risk if you specifically have
it.
the presence of that ApoE4
Is one exercise?
gene. Exercise is really the big one.
But that's what I read that in Peter Attia's book, and I've heard that from Andrew Huberman. They have podcasts and things like that. One of them's, and they're both physicians, but what they've said is that the majority of the research is that this is a weirdly there are weirdly simple preventative mechanisms that you could put into place right. And actually, what they say is they have a huge impact right now,
Yeah.
just even starting small, which
And
is
start
kind of
at any
crazy to
age.
think about.
Start at any age. Yeah.
Yeah.
I mean, that's a segue into the whole brain health, really, which
Yeah.
is something that we're just passionate about promoting. Maybe you could share what you learned from the research.
I'm supposed to,
Oh,
I'm
yeah.
supposed to do that every time we
Brain
say
health.
brain health.
Yeah,
Oh,
so
that's great.
brain
Yeah.
health can be the
I didn't
hype
even have to
button.
ask.
The hype
Yeah.
button.
Yeah, let's get hyped about brains and talk about brains. Yeah.
Yeah.
Definitely. No, let's absolutely get hyped about brain health.
Yeah.
I mean, but this is exciting, right?
It's so
because it means
exciting.
there is something you can do and it doesn't cost money. It doesn't have to.
Yes.
And it's simple and you can start today. It's not too late.
It's never too
Absolutely.
late.
Even if you have it,
And
it can help slow symptoms, right?
Yes. Yeah.
So let me do my little plug for the Alzheimer's Association here as we segue into that, which is so the Alzheimer's Association is the world's largest private nonprofit funder of Alzheimer's and dementia research. So you've got the U.S. government and what they spend on research. You got the Chinese government, and then the Alzheimer's Association is right there. And so that's a significant impact in research. $430 million currently vested in active research. And so this week, actually, July 27th through the 31st, wrapping up today, is the Alzheimer's Association International Conference in Toronto. There are about 10,000 researchers and guests attending this conference. And we just heard from them for their recap this morning. And so they look at literally the kind of the latest and greatest in Alzheimer's and dementia research in real time as it's happening with these researchers. It's an opportunity for scientists, clinicians, researchers to come together and collaborate on these things and really see what's going on. And a big focus was on brain health and prevention. Do you have thoughts on some of the things that you've kind of seen in that space? What's changed?
I mean, there's just undeniable evidence now that we can lower risk through lifestyle changes. And so we've got, a list of different things that all of us can change. I mean, simple things like diet and exercise, a lot of it has to do with our vascular system. So, our the brain is nourished by the richest vascular system in the body.
And
so every time
vascular is blood.
yeah,
Right? Okay.
vascular,
Just for-
blood flow,
Yeah.
blood flow. And so every time our heart beats, like 25% of the blood it moves goes to the brain. And so any sorts of conditions that, block that or impede that blood flow are going to increase risk for dementia. And so these are things like heart disease, diabetes, being too overweight, high blood pressure. And we know that those things can, be addressed and treated. And if we treat them, we can lower risk. And so treating may mean medications, but it also means all these lifestyle factors. So diet and exercise. And for younger people, it's about doing this now.
Yeah.
So you don't get to that point where
Yeah.
you
Yeah.
And
have
it
that
makes sense
issue.
why, you think about blood flow, and I've exercised every day for like almost 10 years now. And I always tell people it totally changed my life, like physically and mentally. You
Yeah.
just feel better. But if you think about blood flow, it's like, yeah, you're kind of, I don't know, hopefully helping your vessels and arteries get that flow, and also to your brain, obviously.
Yeah.
So
I
it
mean,
just
that's
seemed,
what yoga's all about,
Yeah.
too, right?
and
It's
what I
just-
wrote on here was I even saw a thing that was like just even, walking, doing 20 minutes of walking
Yeah,
a
yeah,
day. It's all great for blood flow, and I'm sure for brain health too.
Well,
Yeah,
and
I-
especially depending on your age, right?
Yeah.
Some people may not be able to do much, but maybe they can get out and walk. That's going to help.
Mhm.
But there's so many other things too. I mean,
Yeah, and
you
I think that's where some people think like, I can't make this huge change
Yeah.
and I can't do this huge habit now. And really it is. It's like walking. I was going to
Yeah.
say I pretty obsessively
Track your
Got
have
your
my
walking.
steps tracked
Yeah.
every
Do you
day on.
cheat? Do you do this kind of thing
No,
like
not
all
doing
my
that. Although
girlfriends
I will
do?
read it if I'm in the car and I'm going a little too slow, and it's
Yeah.
like, okay, you've gone a ways, a little bit of a cheat there. But really, like, I mean, we're looking at, and I'm not a medical professional, I will say that, but so definitely consult with, with your medical team on some of these things. But really, like between 6,000 and 10,000 steps a day can make a huge difference. There's variance
Or
in
any
who says what, but
increase
yeah,
over what you're
or
doing,
any
really,
increase
right? Like anything is
over
better.
anything. Yeah.
Park farther
Go ahead and
away
start
Mhm.
from
slow.
wherever you're
Mhm.
Right.
going. Take the stairs
Yeah.
if you can. I mean, just small changes can make, they add up over time, and they help to motivate people and get
And
them
like you said,
excited.
diet too. I know a lot of people.
Yeah.
For me, like as I get older, I try to eat less sugar because sugar's in like
Yeah.
everything. But
Yeah.
True.
just I don't
True.
know, small dietary changes. I'm sure it can be super helpful
Water.
too.
Yeah. And
Yeah,
I
water.
want to say
Yeah.
too, and,
Drink water.
you know, and on top of, starting small, which makes it really easy and accessible to just kind of get moving. But then also looking at like the impact of what happens when you really look at this stuff. And this is some of the research that was recently presented. So we had two different groups in this research study. This was over 2 years. This was the U.S. Pointer study, which is the U.S. Kind of component of this larger global study called the Fingers study. So we got the
Okay.
pointer finger. I think Canada's the thumb. I'm not 100% sure about the other fingers, but so
Okay.
these are ongoing. This was 2 years, and we got these two groups. One group is kind of a peer-to-peer group. They're given kind of resources around how to make lifestyle changes, things that you can do, and then they kind of meet and they talk about it. And they make those changes independently and kind of through having access to them.
Mm.
The second group was much more structured in terms of they're getting kind of a routine.
It's like a regimented
It
Or
is
thing.
like
Yeah.
more like if you imagine in like a clinical setting, your doctor basically prescribing that alongside as part of your treatment.
Mm.
And we see this in a lot of other. We see this across the board in health systems for other conditions. But what they found was both are positive, which is awesome. I mean, because that really shows that they, that there's evidence that continues to support that these changes protect brain health, improve cognition, and then the regimented one had significant benefits. And so what this really means when we look at how something like this is going to is transforming now and healthcare systems is alongside things like pharmacological interventions. You're also going to have these behavioral and lifestyle interventions as part of a regimented treatment plan. Those things together, plus trying to catch and diagnose and get on this quickly earlier, those things together are kind of what we imagine it's going to be the future of treatment and healthcare for Alzheimer's and dementia, and really be able to make the largest
Yeah.
impact.
That's like the arsenal now is
Yeah.
that combined whatever I don't know what the word is,
Well, just
pharmacological
like
Treatment.
medications,
Yeah.
and,
medication plus lifestyle changes.
medication plus lifestyle
yeah.
change. And again, we see that in other things too. And so there's kind of a rich body of evidence. This is something that's
Yeah.
very helpful for a number of conditions, and now we've got it here.
And I'd like to just mention 3 other brain health things,
Yeah,
because
please. Yeah.
besides diet and exercise, I think sleep,
I
there's
was
a
wondering
lot of
about sleep.
Really
studies going
underestimate that.
on
Yeah.
sleep.
That is huge.
Yes. I mean, that is where our
Those are enormous
brains not
components.
just rest and recharge, but where memory is cemented and it kind of the brain is cleaned. And so that's important. Head injury, avoiding head
Right.
injury. And so that has implications, from the time we're babies, right?
Yeah.
I mean,
I was just thinking,
protecting kids
I
and
fell down a
children.
mountain when I was a kid and I had staples in my head and I
Oh,
still
my
have like a
goodness.
misshaped head, but I never thought about that as
Yeah, it's
Wow.
severe or repeated head injury.
okay.
And as people age, it's really about fall risk. So preventing fall risk, because we know that brain injury can lead to dementia as well. And then what was the last one I was going to mention?
Well, you just
Oh, go ahead.
I'm sorry, you made me just think though, and this is like a whole nother conversation, but is this dementia and stuff adjacent or related to like CTE in football? Because I know that's like
Yeah.
because you're saying a traumatic head injury.
Yeah.
Yeah, I mean, great question, and always complicated in terms of how, how things correlate versus, versus
Yeah, yeah.
cause each other. And but what I want, one thing that I think I could speak to a bit. For a little while, I worked for the VA,
Yeah, yeah.
working with veterans who tend to have a much higher risk and prevalence of brain injury, right?
Yeah.
And there is definitely a within the body of research looking at that connection between brain injury and increased risk of Alzheimer's dementia, or of mild cognitive impairment, which is a whole kind of
Precursor.
other condition and term and collection of possible symptoms there, and then that also increases your risk. So definitely things that have kind of a traumatic impact to your brain, or just brain injuries of all kinds, because not all brain injuries are traumatic, but there is that connection
Sure,
there
sure.
that's actively being studied,
Yeah.
and something for people to really be thoughtful about.
And it's all under the umbrella of brain health, which is just like isn't it? I feel like I hear this all the time that like we still don't actually know that much about the brain, or
Right.
I don't know if
Yeah,
that's
no,
true,
that's
but
great. No, I mean, we don't, there's,
we're obviously
and
studying all
it's
the
the
time.
same thing with, Alzheimer's is so much of the research is also just really understanding what's happening.
Yeah.
Right.
Yeah.
Definitely.
Yeah, I'm sorry if you can't remember your last thing, but I was gonna,
Yeah, go
I just have
ahead.
all these other questions. Like we were talking earlier about there's this like 20-year onset, and there's like this new blood testing you can do to
Yeah.
kind of recognize that, and I found that pretty fascinating. But I was curious if you could explain that to folks. Yeah.
Yeah. Do you
Yep.
want to speak just to the, like kind of the diagnostic part, and
Sure.
I mean, that experience of getting that diagnosis, and how it all
Yeah.
works.
Boy, and I'm sure you could speak to that too, getting a diagnosis and how challenging that
like
can
pulling
be
teeth.
for caregivers and people who are living with these diseases. It a primary care doctor, we always encourage people, if you start to see, warning signs or things that are not, normal, they're
What are the
different.
warning signs? Because I think most people I know think, and I did too, as I said up until recently, think that memory loss and acting a little goofy just come as part
Yeah.
and parcel with aging. And so, what is the difference between normal aging and warning signs? And what do we look for?
Well, we actually have a whole class on that. So I'll try to
Yeah.
just summarize a few things. I think with typical Alzheimer's, typically memory loss is a hallmark of that. And that can show up in so many ways, but asking the same question over and over again. So you just talked about it, and 10 minutes later, the same question is asked.
Mhm.
It's recently learned information that's forgotten, not generally things from long ago, but recently learned, and they typically don't remember it later. That's more of a warning sign than just, you forget somebody's name, but then you think about it later. Other types of things are, that can be more subtle, are personality changes. And someone will just, start to exhibit anger, behavior things. It could be, misplacing things. It can be, starting to struggle with doing everyday activities. So I remember the shock for me. My mom and dad, when my mom was diagnosed, they lived in Texas. So I had taken a leave of absence from work to go try and help them and learn a lot more about my mom's condition. And, my mom and I had been kind of doing things all day. And late in the evening, we're still gabbing away. She's getting ready for bed. I'm in the bathroom with her. And she takes her cream-based cleanser, puts it on her hands, rubs it all over her face. And then she looks up and opens her eyes. And as she's, ow, ow, ow. And I said, Mom, you can't open your eyes when you're washing your face. I mean, it was shocking to realize she had forgotten how to wash her face. So everyday activities will begin. So that's not normal aging. Those are warning signs. And again, there's a lot of them. Person's not going to have all of them in the beginning. They might have one or two, might have three or four, but it is a progressive disease. So it increases over time.
That makes sense too, because that's kind of I had this conversation with my sister pretty much about that of like,
Yeah.
well, like our grandparents kind of had the,
Yeah.
typical memory loss. And she was like explaining that it was stuff like you just described
Yeah.
of like, well, this is like stuff within 10 minutes. She's like forgetting.
Yes.
So yeah, I think it's important to
Yeah.
highlight that.
Yeah, and then when we're looking at also, that period of time where there aren't symptoms, where there's still, kind of the underlying causes developing over time for, 20 years, 15 years, 10 years, 5 years, before we get to a point where, somebody's actually noticed something. That makes this so much more complicated and really challenge. I mean, that's kind of the really challenging piece, maybe back to the healthcare side of things. And then one thing I heard that really stood out to me in the medical community is they say time is brain, because that point between the development, even if there are no symptoms, to symptoms to then the progression, the earlier we can get in there and try to make a diagnosis and start treatment, that's where you really have more time to address this. But so the healthcare infrastructure really is kind of in a place right now where where they're actively adapting, figuring this stuff out, and there's a lot of learning and conversations and things that are being rolled out. I know here locally, like the Providence system, their neurology department has access to these blood tests that have been approved by the FDA and are starting to roll out into systems, and more people are bringing these conversations to their providers and really having questions about, okay, can we start looking for this now, or if there's a family connection, using that as kind of a motivation for starting to ask these questions. So this stuff is really happening like right here in real time.
Yeah, no, I want you to explain. I just found the science of that stuff fascinating. I can't remember what you said, but when they do the blood test, there's a specific ingredients, probably the wrong word. I don't know what you call it.
Sure, like what it is that we're looking at.
Checking for.
Yeah, and so and maybe part of that question is looking at like, just diagnosis in general, and so where were we and where are we kind of now and going. And I think, Janis, you speak really well to like what a diagnosis was, and then I'd be happy to.
Because we were before we were recording, you were explaining how traditionally this is purely like a troubleshooting process of cognitive tests and brain scans and all this stuff to kind of rule out what it's not. But I don't know if you want to.
Yeah, I mean, we still today don't have, an ironclad, this is a test, and you take the test and you know exactly what you have. We're getting closer with blood tests, and the blood test is looking for amyloid beta in the bloodstream. And that is a protein that is known to be in the brains of people who have Alzheimer's, and it clogs the brain, if you will. The brain has all these neurons that are, sending communications, and that protein clogs the communication and kills the brain cells. So that's what and it can happen for a long time, up to 15, 20 years, before someone will actually have noticeable symptoms, before it gets to that point. So, but if once somebody is exhibiting symptoms like your mom, right, and she goes to the doctor, the typical approach that they have is to rule out any other thing that could cause behavior or memory issues or these things that she's exhibiting. So they're doing your standard blood work. They're, testing urine. They're looking at health history. They're looking at the all important medication list, right? And then they may do a few other tests like a brain scan, and they're trying to rule out things like simple things, right? I think I might have mentioned, but urinary tract infection, dehydration, thyroid abnormalities, tumors, etc. And they're also doing a cognitive test. And so then the primary care doctor can put all that together. Now we're able to arm them with a blood test as well, which will give them confidence. A lot of times people walk away and they're just told, well, you have dementia. And that might be enough, but it might not spur them on to seek treatment. A lot of doctors don't even really know enough about treatment yet. So, helping people to get connected to resources where they can learn, because treatment right now, it's only for people who are in early stages.
Okay.
So it's either what, Hudson talked about, MCI, mild cognitive impairment, which is where a person's noticed their memory loss, but it's not severe enough that it impacts their ability to live independently yet. Or once it moves into like an Alzheimer's or another progressive dementia disease, as long as it's in the early stage, treatment may be an option if they have the amyloid beta present. So that's kind of how the diagnosis goes. I talk to so many people all the time who struggle to get a clear diagnosis or who don't even go in. And sometimes it's a matter of, their loved ones are in denial. They don't want to go.
Right.
A lot of times.
I know with my case, that was like my sister had to like drag my mom out. She's like, I don't want to. And my family's like that. I'm like that. I'm like, I'm not going to the doctor unless like I'm like bleeding out of my head or something.
Yeah, you don't even take like a Tylenol.
No, I don't.
Yeah.
But yeah, it's super important. And we were talking too about how hopefully, especially in rural areas, like this type of testing can kind of roll out. And
and I'm so glad you brought up the rural part of things too, because whether we're looking at rural or really anywhere, I think one thing that's really important, especially in Oregon, to stress is there is a critical shortage of specialists, neurologists, gerontologists, and then also a lot of these like frontline providers, so home care providers. We have a significant shortage of these professionals for a number of reasons, but it's really having a significant impact. So then you take that and we go look at, the rural parts of Oregon, which, let's be honest, a lot of Oregon is rural. In fact, every single, I believe I'm accurate in this, every single county in Oregon has an area that's designated rural. Even counties you wouldn't think of.
It sounds right, yeah.
Like
Even Multnomah, yeah.
So the rural question is about not only understanding, those communities and kind of what those barriers are, because every community, there's some generalizations, things like transportation, things like whether there's a clinic or anything, even in the area based on population size and everything. But they also vary by, wherever we're talking in Oregon, like you go further out east to the Columbia Gorge, that'll look different than Southern Oregon, than, the coastal parts of the state. But there just isn't a really strong way of bringing this stuff out into those communities. Often, people are going to have to come, find themselves in a situation where they got to come into
OHSU or something.
Or
Exactly.
and imagine, really like take this seriously is imagine that you have recently received a diagnosis with your loved one. You have had to adjust everything about your life. Maybe this was career ending. Maybe this was a reduction in hours. You got to, suddenly there are so many questions. The whole world changes, and there's a lot to process and figure out. And then on top of that, to try and figure out like what you're going to do to manage the healthcare stuff.
Right.
And
the reality is they may or may not be able to help you.
That's definitely
and they may
one of the
say
challenges.
a lot of things that may be hard to hear and sit with.
Yeah.
And then what is the fallout from that going to be like?
Because I think, I forgot if we were recording or not, but we mentioned at some point there is no real treatment. I know there's emerging treatments, right? But
yeah. So there are. I mean, this part is very hopeful, optimistic, and again, actually, I don't think I think I shared this one when we weren't recording. So just think about like Alzheimer's research. People will often say, I think, why has it taken so long, or why aren't we at the same place that we are with cancer? Well, cancer's got, like 100 years and so if we really look at like Alzheimer's and the research history here, I mean, okay, so it was first discovered and named in 1906.
That was actually one of my
Okay.
questions. I was going to ask
Yeah.
about the
Okay.
etymology of the
Yeah, and
name.
I'm happy to speak to that
But yeah,
too. But
1906
is kind of our starting point. It wasn't until the 80s that we really started having what looks a little bit more like modern research into
Sure.
this, and there were fewer than 100. I think we're talking like 40 or 50, maybe 60. I can't remember the exact figure on that, but fewer than 100 researchers. These are principal investigators who are, in the process of doing their research around this. And now we look today, and there are thousands of them.
Yeah, you just said that conference
and
had
then we look at our conference,
10,000.
right? And this is a global network of 10,000 people, plus they've got their whole remote track that's bringing in thousands more. And so anyway, there's just a much higher volume of folks who are actually, actively doing the research. And then research also, it compounds on itself. So if a treatment comes out, I want to say the kind of one of the first big treatments came out. Can't remember exactly when that was.
2021.
2021.
Yeah, I was gonna say, I
around
remember
that.
hearing a few years ago there was a clinical trial or something.
Well, so it was a clinical trial that then led to kind of the accelerated FDA approval of a drug,
Sure.
aducanumab, and that's a foundational point. And so that particular product is not the thing that's going to be the magic heroic moment, right? But then just a few years later, we've got two more of these treatments that are the efficacy of those has increased significantly. And so, just looking at the future with these things that they compound on each other. And so we really expect to see that these things are getting better and better and better over time.
They essentially, they don't cure. They
Okay.
do not cure the
Correct.
disease. I just
Right.
want
And
to be
that-
real
that's
clear
clear.
with
Yeah,
that.
these are not
there's
cures.
no cure.
No,
They are
progressive brain death.
effective.
they slow.
They slow progression, and they are effective in the very early stages. And so when we look at things like having more time if you are able to get your diagnosis early, or they're also looking at how you can kind of prevent by really getting started if you're high risk. And and then some of the things that have really changed even over the last year is the delivery system of the medications is something that's changing. So instead of, say, this, for folks who are rural and they've got to go back and forth for an infusion, now the delivery system, maybe it only requires I think it was a subcutaneous injection, and some of the stuff I can't speak as much to, so I won't butcher it. But
what is that? Just a normal injection, or what does that mean?
See, I can't. That's what I'm saying. I can't speak to the specifics
the vision
on.
Is more like the weight loss drugs, where it can be self-administered.
You can just do it yourself.
I see.
Self-administered.
Exactly, or it could be administered by the caregiver.
But that we're not there yet, I don't believe. Are we?
That is
reported.
That is a little part of our research conference this year. Is
updates
on the delivery systems.
That's awesome.
So yeah, and so I'm just saying this more as kind of to think about how these things are changing.
Yeah,
there's
no, it seems like there's huge progress
as the research continues.
Are happening.
Yeah.
They're building on the foundations of previous research, and it just keeps
right. And so,
but in the end, though, this disease, even today, it takes a village. I always tell caregivers, it takes a village. And so when there's a diagnosis, the family, we need to build a care team, because this is a long, difficult disease. And it's going to take more than one person. So they've got to find their backup, their outlets. Families have to have discussions, need to make sure all the legal things are done so that you can operate as a person's legitimate power of attorney, et cetera.
Right,
All
right.
those things are coming. So I think that's another area where
So
the
overwhelming.
Alzheimer's Association can help, is just to bring support to
For sure.
caregivers,
Yeah.
be it in a support group, be it through education, to just learn about what to expect, how to build your care team, how to be a caregiver, how to communicate with your person. Because as this disease progresses, language goes away. I
Mm-hmm.
mean, we think about, a person doesn't speak as much, but also over time, they can't understand as much either. So we as caregivers have to adapt and learn how to do this for our family members. Or, down the road, it could mean a person has to move to a place where they can get more assistance. And so just having support in making those decisions. And I just think I want to make sure that caregiver side comes out too, because this is it can be soul crushing. They need to look for support. They need to, I think support and education are the two most important things for caregivers, but also, still finding humor, still finding ways to love your person and
Mm-hmm.
share that love with them, because they're still there. And, so I think all those things are things that we need to help caregivers with too.
Yeah.
So sorry, that's my little
No,
No, I-
caregiver
very, very
rant.
important. Yeah.
It's
That's
And
great.
my
it
passion.
makes me
Uh,
think about when you are in a position of looking for resources, and let's especially here in Oregon, you want to know what comes up? It's the Alzheimer's Association, it's the ADRC, the Aging Disability Resource Connection, and those are kind of really the primary
That's kind of
ones.
it. Yeah.
I think Oregon.gov, there's two primary listings, maybe a third there too. And so Janice said it takes a village.
Yeah, it does.
And it really does at like the community level and the grassroots level. And this is something I really want to stress here is we're talking about individuals whose lives are devastated. And we're also talking about communities and families and neighbors and employers who are affected, because these are folks who are working and living in all our communities. It is incredibly hard to quantify caregivers.
7 million people in the whole U.S.
Right.
living with this disease.
Wow.
So that's 7 million families
Right.
that are impacted by this.
Then it's so hard to know the exact number of caregivers,
Right.
because caregiving can be solitary.
Mhm.
It can be
shared.
It's very, very unique to all situations. But we're looking at an estimated almost 200,000 Oregonians, and this is just for Alzheimer's. And so you think of all the other things, and so there's a huge chunk of folks here who are in these caregiving roles. These are often family members, neighbors, close loved ones, friends, who are in roles of unpaid caregiving, who are also juggling that with the responsibilities of just day-to-day life. And so one thing I really want to share that I think is pretty incredible, and a wonderful model for what we need more of, is the Alzheimer's Association here has been very, very, very persistent in making sure that we are bringing resources and making connections in especially rural parts of Oregon. We have a grant that we've been working on for a number of years that involves a number of community-based listening sessions. It involves community conferences. It involves volunteer recruitment, all these things where we are literally physically going and being present in a place like the Dalles, where we've been very active, or just places that we haven't really had a whole lot of healthcare presence in, or community presence in.
Well, I want
And
to mention really quick.
yeah.
I had the chair of Baker County on here a long time ago,
Yeah.
or 6 months ago, but we talked about that, how like rural hospitals and rural health is really
Right.
struggling. So like that just seems like a huge,
And we end up being
hugely
basically a key
important.
resource. So like, for
Yeah.
example, like we have a caregiver support group in Baker County.
Okay. Yeah.
You know, and so really trying to make sure that we are helping to fill and bridge the gap where there is need for that. Because if you don't know, I see it as basically like, you know, if you're looking for, you know, if you're looking for a life raft,
Right.
you're going to go seek it. But if you can't find it, and so just making sure that there's that visibility there and that presence
Yeah.
there. But really needing, I mean, it's not like we just go to, you know, Baker City and it just all works out. It's about having conversations
Right.
with, you know, civic leaders, community organizations, engaged volunteers. I mean, people like
Start
Janis, yourself, who
building relationships.
Yeah,
that's
it
how
is
this
about
has to
that.
work. And
is.
we have to have people engaged and involved. And I think there's so many different reasons if we're, you know, depending on whose interest, we could talk about, you know, the economic impact this has on, you know,
it's staggering.
on
It's
everything,
enormous.
on our healthcare systems, on
Workforce.
our workforce. So, you know, this is something that right now we're in a pivotal moment where there's a lot of exciting things happening. And it's also not a time to just kind of sit back and watch these things happening. We have to keep this momentum going by actively, you know, moving with it and trying to create things that are sustainable. It's a lot of infrastructure building right now, and really moving forward things like policies
There's
and
also,
programs.
I think, help coming. Like I know through our advocacy work at the federal government, we've been able to get attention and funds and programs that are helping some with the rural and educating rural doctors. We also are beginning these navigation programs. It's being piloted in a few states. It's piloted in Washington State right now. It should be coming to Oregon hopefully soon. But so that when a person gets a diagnosis of a progressive dementia disease, they will have a resource that can help take them through this process and expose them to other resources, help them deal with, you know, that just the not all medical, some medical, but all the other support services too. Much more like what happens when a person is diagnosed with cancer.
Yeah.
And so that's exciting. Those are the kinds of things that the Alzheimer's Association has been working on from an advocacy perspective. And I just want to say one other thing about volunteers because
Yeah. Do you need volunteers?
oh my
Yes,
goodness.
always.
So
Yeah.
our Alzheimer's Association covers Oregon and Southwest Washington.
we're
How many of you
all
are there?
36. Okay, so we're all 30 here. Let's let this one sink in. 36 counties in Oregon, and then 2 counties in Southwest Washington, Clark and Skamania. And there are 12 of us.
Wow.
And so and that's in different departments. I mean, that it does include our sole operations person and our sole, you know, communications person. And so we really, really need engagement from volunteers. We really, really need engagement from leaders in the community. And we really need everybody, businesses. We need, we do so much relationship building because we cannot accomplish these things without a strong network.
Absolutely.
And I think just about anybody can get involved because there will be a way to get involved.
I mean, I'd say it's well over 90% of the program.
Oh yeah, 96% of our education and our support group delivery out in the community is delivered by volunteers.
Wow.
So, and we have our own little network trying to support each other and
Right.
train and bring new people on. It's, you know, a lot of us are here because we've lost a loved one to this disease. And we know the pain. We know how difficult it is. And so our game is all about trying to reach out and help others who are going through this, whether they're living with the disease or they're, you know, they're a caregiver. So, and I think a lot of times, you know, after we've, you know, been through it and we've had our chance to grieve, then we're finding our way back to the association to give back. I mean, the association was so helpful to me.
Yeah. I'll put a link in to like the volunteer page, but I was also curious, like,
Thank you.
I think the outreach stuff in the other counties, that's fantastic. But I was also curious, like, is there if someone's in the Portland metro area, is there like a physical spot, like you have an office people can go to?
Oh yeah. We've got we actually have a number of offices, but our central office for the for our chapter is in Lake Oswego.
Okay.
And then we also do have an office in Bend, and an office in Salem at the Center 50 Plus.
Okay. And that's just people can just show up and you have resources and all that stuff.
Absolutely. Yeah, people can show up. I mean, there is Salem is one staff person, Bend is one staff for all. And then, here it's basically kind of the back and forth and all over. I mean, really, our team travels a lot.
Yes.
But yes, I mean, please, we have a 24/7 helpline.
That's what I was
nice.
going to say. That's a good
That's a
time
big
to
deal.
talk about that.
And
a big
so
deal.
anybody can reach out.
It's a national line.
It is, and it operates 24/7. It's staffed by master's level clinicians.
That's huge.
I never promote something that I have not actively vetted. And so just as an employee, I've called them to see what the experience is like, and they're wonderful.
What
They're
is that
really, really great.
number?
It is 800-272-3900.
That's amazing. You know that.
Oh, I'm full
Kristen's
of
putting you on the
full of little data points and
Everyone
numbers.
should put that in their phone as a contact who knows someone who has this
That's right.
disease, because then you have it or you can share it with others. And it's an incredible lifeline at times where you're just like, I don't know what to do. My loved one will not get in the shower. They
That's
haven't
simple.
showered for a week.
So they can call you for things like really
Anything.
anything like
Yes.
that.
Anything.
Because I know it just feels a lot of the time you just feel like you're a burden on people all the time, even if you're a caregiver. And nobody wants to hear about this. This is really simple. I'm not asking for a support group.
yeah.
This is the kind of thing I should text my friend about
Yes.
or just write in my journal. But you're saying go ahead and call.
Call the line.
They're waiting there. They're waiting for the call. That's it by design. I have had the kind of the opportunity and I guess honor to have represented now two national lines like this. The 988 crisis line, and then our 800-272-3900 number, and they are waiting to talk to you.
Yeah.
Because they want to
Help
help.
in 200 languages.
Wow.
Mm-hmm.
Wow, that is great.
So we can help anyone in most any language. It's a first point of contact. They can also connect you with your local resources. You can even ask them, hey, do you have a class about this? And they can tell you about the classes or support groups. But any of these other crazy questions that we have, and then our website as well is a wealth of information. So anything, it's alz.org, but you can find anything you want to know about research, about treatment, about the disease itself, and then an enormous section all about, as a caregiver, the things you might need to know. I think the one other thing maybe we should mention is a new app. So this is just out. I think it's out maybe a month or two.
Yeah, it's been a few months.
And you can download it at any of the regular stores. It's designed for people living with the disease and caregivers, but people who are comfortable, obviously, using an app.
Sure, yeah.
So, and it can help just also be another resource on, it's called
My All's Journey. Yeah.
My
Okay. Oh, I
All's
see it right
Journey.
here. Yeah.
Yeah, My All's Journey, and it is just a really great guide and resource that pulls a lot of that information that we have from the website, but also pairs it.
easy.
Yeah, it makes it pretty straightforward, and then it pairs it with kind of you almost think of it like a checklist or a timeline or a plan,
Yeah.
because that's where things really fall apart for people.
Yeah.
Is
Totally.
when do I start thinking about this, or how do I do this? And this stuff
So
gets
overwhelming.
really overwhelming. Really
Yeah, and I could
fast.
see how,
Yeah.
it's just such a heavy thing hitting you that people just want some kind of guidance, and that seems
Yeah.
really
and
important.
it's vetted too, because
Yeah.
I mean, I grew up with the internet, love the internet. We do lots of cool things with the internet, but it is very important to know that you've got that trusted resource
Right.
that's
Absolutely.
laying these things out so that it's not like somebody's opinion or
Somebody's
like
blog or
something
something.
that,
Yeah.
beat the
Yeah.
algorithm and got to
Yeah.
the top,
It's not
whether or not it's,
exactly the type of thing where you just like, oh, I'll pull up a YouTube video and they'll explain
Mhm.
right.
everything I
Yeah.
need to do. There might be some helpful stuff in there, but like you said, I think having a vetted source for that is
Yeah.
absolutely
Just a
helpful.
solid foundation.
Yeah. Yeah. Is there anything else serious you want to talk about? I have a bunch of my funny questions in here.
I love your funny questions.
I was going to ask, like we were talking about, lifestyle changes and stuff. I always ask a bunch of food questions, but is there any like food things that are good for brain health, like specific
I like that
foods?
question. I
Doritos.
remember I was over at
I don't know.
OHSU a number of years ago because people love this question because I mean, who doesn't love food?
Right.
And I say this stuff as like I don't think there's a prescriptive food,
Right.
but like I listened to this really interesting presentation by OHSU about the Mediterranean diet.
Oh yeah.
And so this is, it's high in fish, it's high in like fruits and nuts and proteins, and then and kind of low in red meat. And then one of the key ones was is olive oil.
Mm.
And I remember this question that will stand out to me, and I'll probably remember for years, was like just this really sweet, this sweet older gentleman asked about exactly how much olive oil are we supposed to be eating every
Yeah.
single day, and so there are,
I wish they could give us that,
Right, yeah,
just
well,
tell us exact formula for prevention and treatment. Yeah. It's
well, the study they were
so
doing
difficult.
was like an absurd amount of olive oil.
Like
Like
a lot of
we'd be
it.
like drinking like glasses of
oh, it's
olive oil.
hysterical. Really?
And so there definitely are things like that to be keeping in mind. I mean, it's the
Lots of
lifestyle and behavioral stuff is
vegetables and-
you got to pair it with things. And
Right.
so
Right.
Yeah.
it would be like modifying diet like that plus exercise plus, making sure that you really are figuring the sleep piece out.
And
It's-
cognitive stimulation. That was the one that I
Okay.
hadn't
Yeah.
mentioned
Okay.
because
Sure. Yeah.
there's research about that too.
right.
And it's not just, sitting at a laptop and doing solitaire over and
Right.
over. It's things that actually require more planning or deep
Engagement.
thinking and engagement.
Like
'Cause-
work, honestly.
Work.
I mean,
Problem
hasn't there
solving.
been, now that we're aging, I mean, I've seen this because some of my friends are 10 or more years older, and I haven't seen this in them, but I've seen this in our peer group.
Yeah.
Just people who retire,
Yes.
they end up retiring too early. Like they
Mm,
retire in their 50s or their 60s, and our median age is, in our 80s or late
Yes.
70s or something. And suddenly, like their whole life has been work.
right.
And then suddenly it's like, what do I do with myself?
Mm.
And they have all these plans about things they could do with themselves, but slowly they don't come to fruition. And then a little depression sinks in. And you can see why there might be
Yeah.
some decline.
I'm kind of the poster child in a way. I mean, I retired at 51.
Okay.
And
Is this your work now then?
This
This
is
is
my
what's
work now.
mentally
this
engages
is my
you.
work now. I mean, this is what I do. I spend kind of
Well, you
crazy
have a
amounts of
puppy too
research
now.
and things.
You got a puppy as well.
And, well, I
That's
have a puppy
Well,
as
that's
of
work
a
too.
day or two
Yeah.
ago. But
Wow.
but it's just you have to find something that is your purpose.
Yeah, that's
And
exactly right.
People lose that sometimes after they retire. But keeping yourself cognitively stimulated is so important because that's causing, when we're babies and our brains are developing, that's how all those synapses, they
Yeah.
they're firing. And if we quit firing those things, then it's just like your muscles, right? If you don't use it, you lose it. So it's really important to keep engaged, keep a purpose, find something that drives you. That's why I do this. I also teach a class at our local community college about, assisting older adults. And so, and then a million people I talk to all the time. So I keep it going
Yeah.
in the brain. Got to.
There's
Yeah,
a.
go
Okay,
ahead.
go ahead.
Well, I was just going to say one kind of simple one because you mentioned work, and think about the routines that we fall into sometimes, especially if, if you wake up and you
Yeah.
eat your breakfast and you commute to work and your commute's exactly
Structure
the
to your
same, and then you do
day.
your thing and you come back. And even just like take a slightly different route, go down a different street. And even if it takes an extra
Challenge
minute or
yourself a little
two,
bit.
Yeah.
because that, even if it's subtle, that's the kind of
Mhm.
thing that like
Yes.
it's going to activate some part of your brain that has to pay attention and to and observe something new.
Try a new activity.
Exactly.
Learn a new skill.
Brush your teeth with the opposite hand.
Right? Anything
Try
that
that
gets you
one.
out of that like
That sounds like a challenge.
autopilot,
Yeah. I don't even know if I could do that with my left
Yeah,
arm.
it's a
but
challenge. That
Andy,
gets your brain going.
go ahead
I
with
would just,
what you were
there's
going to
two
ask.
things that, one of these is maybe super unrelated, but there's a common thing in, like, I'm a millennial in my generation of people say, brain development kind of stops around like mid 20s, but then I also hear that it starts to decline after that. I was just curious if that's kind of what
Right.
as
And
to be.
see, that's one of those things that's like, it's complicated to answer because it depends what you're looking at.
Sure.
But what I can say is that neuroplasticity is a term I really like, which is that you can, basically your brain can always learn and change and create new neurons. That's something that doesn't stop.
Okay.
Maybe it slows down a bit, but you can always be learning new things no matter how old you are. And
That's like the exercise for your brain, basically.
It is.
right.
Yeah.
I mean, it's like the brain is, it functions, and there are things that you may not be as quick. Like some number of years ago, it hasn't been that long. I was like, I'm gonna try to learn how to play piano. I don't know how to do it at all.
I mean, that's a great way.
Good,
That's a great
but it's like just
example.
a fun, interesting hobby that I've stuck with and kind of keep coming back to.
Yeah.
And I know I feel it, I'm not quite that
Yeah.
old yet. And
I know
I
all
know I'm
that.
slower than I would be if I was 6. So,
Yeah,
but it's like,
yeah.
you just keep
I
doing
remember
stuff.
I know you guys all probably heard this, but I remember, when I was a teenager and in my 20s, they're like, learn languages or instruments at this age because it's a lot easier now.
Yeah.
But I agree, like you can really at least try that stuff at any age,
Yes.
and it's always interesting. The other thing I was going to say is like, and I'm not trying to. I guess I'm a pretty openly known like anti-AI person, but what you're
Are
saying
you
about,
really? I didn't know that.
I mean, I use it sometimes, but like
Okay.
there's these studies now that say that like the use of it something to do with like degenerates your brain cognition or something, and so I was just thinking with what you were saying, it seems important to maybe do some stuff on your own sometimes, not rely on the AI, and maybe that'll activate your brain a
Yeah,
little bit.
I feel like broadly, I can kind of have thoughts on that broadly.
I'm sure you can use
that would
AI
include
yeah.
one thing that is some of our technology, I think, is can become a really passive experience really quickly, right?
Like TV.
Television, social media, AI. Now, I think that all of these things are, tools that are helpful and useful in some way, and also to be mindful of moments where you've kind of become very passive in a lot of ways and where you're not having to do a whole lot of thinking. There are studies, these are things outside of our organization that I can't really speak to, but where you're looking at like, activity in the brain and things like gray matter and what that looks like during certain activities. And, there's a big difference between, gray matter and neural activity when you're playing an instrument versus scrolling through your phone. And so that's kind of what I would say there is it's about that active versus passive participation and thinking.
Yeah.
I don't know if you have thoughts on that, Janis.
No, it's the same thing. Solitaire on the laptop is nothing. You need to think. I think just building a piece of IKEA furniture.
Oh my God. Yeah.
That there's no words. And
no, there are not.
It takes so much concentration and rechecking and effort.
Yeah.
And, I think my synapses are going when that's happening. There's
a
lights
great
in
example.
the brain, right?
Problem solving for stuff that you're not
Yes.
really used to.
Yeah, exactly.
Yeah.
Exactly.
I just wanted to bring something up real quick that you pointed out before we were recording about the difference of like how this affects men versus women, and there's like a disparity there, right?
There is. At age 45, the lifetime risk for a male is 1 in 10 to develop Alzheimer's or a progressive dementia disease. For women, that number is 1 in 5. And so this disease disproportionately impacts women. of the people in the U.S. with progressive dementia diseases, 2/3 are women. And of the caregivers for people with dementia, 2/3 are women. So
It's a
this-
really
yeah,
revolving around women in many ways. Yeah.
in so many ways. And, it's interesting in support groups. We'll have, a lot of spouses, male spouses who have just, and this is what I saw with my dad caring for my mom before he passed away. It just is such an overwhelming thing for them because a lot of them feel like, just going from doing your own chores and the things you've been doing and having your life to suddenly taking on yours, taking on everything they did, and adding caregiving on top of that. So it's interesting because that dynamic occurs too. So it impacts men in that way very strongly. And not to say that men do not get this disease, because they do as well. But
because 1 in 10 is still
1 in
That's
10 is
huge.
still a lot.
Yeah.
Yes.
So when you say from age 45, what does that mean? Age 45 is when the risk factors, or when disease diagnosis, they've identified that that's the age it becomes more prevalent, something to watch for, where if they're trying to figure out what's going on with someone, age 45 is the age they might begin to say, this is something we need to look at, whether you have Alzheimer's.
Yeah, right.
I'm not so sure if it's that, other than just saying they're pegging it to say at that age, then it's a 1 in 10 or it's a 1 in 5.
45. I'm
That's one
just
thing
trying
I
to
can,
wrap
I
my
can
mind
speak to
around
that
that.
a little bit in
Yeah,
terms of
go
your
for it.
question. So part of it is so why 45 is it's part of if you look back at so if we're looking at 65 as kind of the point where we start to see really increased risk year over year, you go back 20 years. So if we're looking at how the disease progresses pre-symptomatic for up to 20 years, that's the
Yeah.
45 point.
Okay.
And
makes sense.
that study looked at a demographic that doesn't actually tend to get looked at in research around Alzheimer's because there's a lot of association with older age. But so if we're looking at folks in their mid 40s, it really opens up a really important demographic that is kind of commonly referred to as the sandwich generation. And these tend to be women who are caring for an older, maybe an aging parent or another older
Wow.
adult, and also at the same time caring for children of some age.
And
And
they're
so-
getting Alzheimer's, but they don't know it. They probably don't know it yet because they haven't had an onset of
and-
symptoms that them and others have
Potentially.
recognized potentially.
Yeah,
Yeah.
potentially.
It could
Potentially
have those
that's the time of your
changes.
Because
life
it
where we
could be
start seeing
20
that
years
stuff.
before it manifests in that way.
Can be.
Wow.
Yeah. Can be.
Yeah, and I was thinking too, I don't know if I could be way off on this, but that the 20-year thing, that's I keep forgetting the protein you mentioned. That's kind of,
Amyloid beta.
okay. That's when that you can kind of start to see that in
Yes.
blood testing.
Yeah, there are two it's amyloid beta and then tau.
Mhm.
And they both
TAU.
TAU,
Yeah.
and they're both unique. And I will just say very quickly that the treatments that are available now are really focused on anti-amyloid.
Okay.
And so tau has a different place, and there's definitely ongoing research and treatments, clinical trials looking at tau. And then there are something like I think 111 active clinical trials that are really targeting kind of the removal of these proteins.
Okay. That's what I was wondering earlier, like
Yeah.
those ones that are in clinical trial, they basically attack those proteins to kind of flush out the
Almost like
blockage.
radiation or chemo or
some of this stuff I can't speak to
No,
as
it's okay.
eloquently, but
Yeah, I
like it's
can't
about
either. I'm an idiot about
like
that
they're really
stuff, but-
interesting. So that you get your blood-brain barrier, right?
Uh-huh.
And so what happens with these treatments is they're kind of the efficacy is related to the quantity of the the chemical medication, but it has to get through the blood-brain barrier, which your brain doesn't want anything up
Yeah,
there.
I
And so it's
see.
actually very like we have
Yeah.
very, very, very solid protective, mechanisms there. And so what they're looking at is in delivery of this medication, how do you get it through the blood-brain barrier? Because they've seen that when you can, you actually see a more of a reduction of these proteins. And so there are just like some other types of research, I think in cancer we've definitely seen this, where there are delivery methods based on protein chains and something, and they're able to better target and get through to where they need to be, in the body. That's something that's ongoing in research too.
Cool. Do you have any more questions before
I don't think you.
into this? We kind of covered some of this, but do either one of you want to share anything about your Northwest story? Did you both kind of grew up here? Did you move here at some point, or?
Yeah. Oh, yeah, sure. Yeah. I mean, I've been, so right at the beginning, you were talking about my name, and my name always gets flipped. Because my last name is Tyler. Everybody always calls me
that's
Tyler or
funny.
some variation. Or I get Houston a lot. But no, so I was born in New York City actually. And so
Okay.
there's the river connection. I literally was named after the
The
river.
Hudson. Okay. Yeah.
But I've lived in Oregon just about most of my life. We moved here when I was very, very young. And I grew up in Eugene. And then ended up going to U of O here and have been in Portland now for I think about 10 years. So
Nice.
very, very much local here and care an awful lot about Oregon.
Cool.
Yeah.
Yeah.
I grew up in Chicago, and then I moved to Northern California, out of college, and I've lived multiple places in California, but I've been in this area now for 28 years.
Okay.
And yeah, love the Northwest. This is definitely where I will stay. So,
All right. Fair enough. Kristen, we kind of know your story. I mean, you could share something
Ad
if you want.
nauseam.
Kristen has a
Lifelong
whole Kristen has
Portlander.
hundreds of podcast episodes he has too. Yeah. Okay, let's see here. I'm gonna start prefacing these. I'm sorry if any of these gross you out. These are all like junk food related questions.
Probably not good for
Probably not
anyone
brain
trying to prevent
health friendly.
Alzheimer's or
I mean,
treat Alzheimer's.
maybe there's new research coming out. I don't know.
Yeah. I mean, if hot tamales is part of it, I think I'm well on my way to prevention.
Everything in moderation.
Well, that's
There
true
you go.
too.
There you
That's
go. Yeah.
right.
Like I love ice cream. I'm not gonna stop eating
That's
ice cream
true, too.
100%.
That's true
Okay.
too.
I do have an ice cream question. Well, maybe we can start with that. Let's say you're getting ice cream somewhere. Do you go waffle cone, regular cone, or cup?
Cup for me.
Okay.
Yeah.
I do cups too,
I do the cup. I like.
but I don't get ice cream very often.
Okay.
I am not
Why
a sweet
why the
person.
cup though?
I don't
Because
like the
cone
drip.
is so sweet, probably.
Okay.
Yeah.
I tried. I don't like the drip. That's
Yeah,
why.
I was gonna say I think it's a convenience thing for me.
Yeah.
I like the drip as far as fashion. No, I'm just kidding.
Yeah.
What flavor are you putting? Do you have a favorite flavor, ice cream flavor? I know you just said you don't eat it too much.
Yeah. I mean, if I was going to do it, I'd probably have something with fruit and nuts.
Okay.
Wow. Okay.
Yeah, I've salted caramel, anything like that.
Classic.
But I have a least favorite too.
Okay.
I have never liked chocolate ice cream.
Huh?
I
Yeah.
could say. You know what's funny? I had a coworker about a year ago that was like almost entirely anti-chocolate, and I was like,
Mm.
"What is going on?" But he specifically, I think, called out chocolate ice cream.
Yeah,
for some reason.
I like chocolate. Chocolate ice cream. I don't know. Maybe I just haven't had a good one.
I feel
When
the
I
same
lived
way.
in Switzerland briefly,
Yeah, that's
Well-
open pick chocolate ice
Yeah.
cream. That was my exception
Yeah.
for ice cream. Oh,
What is it called?
the brand was Movenpick.
Yeah.
Okay,
And
maybe I'll put a photo of that.
It
up
came
later.
in the itty bittiest little container. We buy ice cream in giant. They're just
Tubs,
small little. Of course,
yeah.
the freezer was only about that big. So, and
I'm gonna have to look that up.
it was so good.
What about if I ever asked you this,
What's that?
the ice cream question?
Well, if
your
I'm at
favorite?
Salt and Straw, which I was last night, I always get salted caramel swirl.
Okay.
I get it in a waffle cone. I get a kid's scoop.
Isn't that like what's on their logo? Is it? I don't know what I'm thinking of. I feel like there's like a salted caramel thing or
There
something.
might be.
Do you like crunchy or smooth peanut butter? Maybe you don't like peanut butter.
I do smooth.
crunchy. Yeah.
Okay. I like all peanut butter, but I am team crunchy.
Do you like
Uh,
oil or no
oh, yeah,
oil?
stir.
I mean, oil where you've got to stir it
Yep.
yourself.
Yeah.
I mean, I don't love that part. I don't know if I have a strong
Agreed.
preference, but I would go for the not oil if, it's
Well,
just,
maybe the brain health, you can put some olive oil in there.
yeah.
Right. I don't know what that tastes like, but
But if olive oil is the key, my husband's going to live forever. But if it's allowed to have habanero olive
Oh,
oil,
wow.
Ooh, that sounds
Okay.
good.
I
Yeah.
want to
Eats that
specify
like
on
fun.
the
crazy.
olive oil piece, actually, which I thought was interesting because
Mm.
when you cook it, that changes the composition of it in some way. And so this was like raw olive oil that
Okay.
was
Okay.
basically,
Drizzling over.
you'd be
Yeah.
drinking it, basically.
Well, she knows my love of Starbucks. For a while, Starbucks had an olive oil drink. Do you remember
Did they
that?
really?
It
No.
was some kind of oil drink like that. And
Okay.
it wasn't too popular. I did try it, but anyway,
Do
maybe
that
that.
for the Alzheimer's and a little vinegar for your diabetes and
There you go.
yeah.
I don't have diabetes, but
No, but I'm not you, the
I know,
royal
I know.
you, you know?
I know.
Yeah. No.
um,
Fortunately, you have neither.
yeah.
We'd like to keep it that way.
I'm just keeping my gout away. But do you have? This is a new question I never asked. Do you guys remember? This sounds really weird. Do you remember the pin thing that you put your hands in that you could buy from Spencer's Gifts?
Yes, I
He
loved
knew
that thing.
immediately
I'm
what
sure
I was
Brainwich
talking
had it too.
about.
Yeah.
That's
You can put your face
gotta
in
be
it.
like a
Yeah.
millennial experience. Like,
Yeah, yeah.
Yep.
I just
I
I
find
don't
that was
know.
in our schools. Like,
I'm also like curious like why that thing doesn't have a name. Maybe it does have a name, but anyway, I was just thinking about those recently. Do you have a favorite type of French fry? Do you like crinkle cut, regular cut, curly fries, waffle fries, tater tots? I consider tater tots a French fry.
I'd probably do a tater tot.
Okay.
I don't know if I have a preference. Yeah, I don't.
You don't discriminate against any.
No,
Yeah.
just anything. If it's a fried potato, it's
Okay.
okay
I
by
can
me.
get down with that.
Yeah.
Yeah. Do you want to throw out some favorite cheeses? Do you have favorite cheeses at all?
Manchego,
Manchego? I don't even think I've ever even heard of that.
Spanish cheese,
Mhm.
yummy.
Okay.
Yeah, I'm a big cheese fan. Say most cheeses. I mean, some that I found other people don't like as much. Swiss cheese, I like. Blue cheese, I do like. There's a really like hard cheese called mimolette
Okay.
that is, I think, an acquired taste probably, or it's a experience. It's hard and kind of interesting, but I like it.
Okay. You got any new cheeses you want to?
No, I'm still into the smoked Gouda.
Okay. What was the
Yeah.
crystal one you mentioned?
They do have it. If it's aged, it has
Crystals.
yes, it has like little crystals in it, and
Okay.
that is my favorite. And I just learned from the Zupan's cheesemonger that there's a goat cheese that's aged the same way, and
Okay.
it also has those in it, and it's very good. But I mean, you might like it if you like unusual cheese.
Yeah.
It's much sharper.
Do you like goat cheese?
What is the
I do,
crystal
yeah.
though? Like,
Well, it's just if you age it long enough, it forms these little, I mean, that's literally what they look like in the cheese. And then it's like, it's tiny.
Salt
It's
or
little, almost, I don't know.
Is
It's
it
crunchy.
crunch? Yeah, it
Yeah.
is. So it gives
Just
it
a tiny bit,
texture.
just a tiny bit.
Yeah.
Not like a Rice Krispie or something,
Yeah.
but it's very subtle
Mm.
and it's,
Do they have
I don't know,
flavor?
I really like it.
The crystals?
Not really. It's more like an
Okay.
enhancer,
Texture
like
thing.
like salt would be on your food,
Okay.
you know?
Yeah, I was gonna. You made me when you said goat cheese. Do you remember? I went through a period where I was drinking goat milk for a while,
Did you really?
and
What
I
was that
enjoyed it.
like?
I enjoyed it.
Huh.
I was
Oh,
getting
does
into.
Does it
good
taste
for
like
you.
the cheese?
I don't think so because I don't
No?
really like the cheese very
Okay.
much. But I do like the milk. I was getting it
I've tried
delivered
it.
like from an old school, like the old school
Mhm.
glass
Wow,
things and
okay.
everything, but I haven't done that in a while. Uh, let's do a couple more here. Do you guys believe in aliens, Bigfoot, or ghosts at all?
I mean,
It's okay. You don't have to say.
I
yes
mean,
or-
the aliens piece is like just there's a high it's a probability thing, like
Mhm.
probably. Ghosts, I'm a little iffier about, and Bigfoot, I've got to rule that one out. Even the Pacific Northwest thing,
Yeah.
you know,
I'm on the
staple
same
here,
thing. I'm
but
like, it's a fun tourist thing. but
yeah, it's a fun
whatever.
tourist thing. There would be some real evidence.
Something
You know,
at
it's
this
it's
point.
funny how Bigfoot disappears off the face of the earth the second we've all got smartphones. You
Mhm,
know?
mhm.
It's true.
Yeah.
Yeah. Great point.
Okay.
How do you feel?
Yeah.
Aliens, I think, for sure. I don't know if I'd call them an alien,
Uh-huh.
but there's life out there besides us.
You mean it could, even if it's just bacteria or something?
There was actually a thing.
I think it's I think
You think it's more than
I do
complex
think
than
it's
that?
more than that.
Mm-hmm.
There
Yeah,
was a
I
thing
mean, I
this
think
week about they detected some component in the atmosphere of a exoplanet that was like indicative of life, but I think it was more microbial or something. But
What about the other things?
Yeah, no,
No,
not
no to
really.
Bigfoot, no to ghosts.
No, no.
it's okay. Do you guys want to shout out I always give people a chance at a local restaurant if you had a good meal, or just a local business that you
Yeah,
went to recently?
I actually do. This is just a gem. And this is not a work-related endorsement. I have to
Okay.
be very clear about that. There are a lot of rules when
Right.
you're working for a nonprofit. IRS, this has nothing to do with my work. No, I really like the Covert Cafe over on 82nd. They're a gem. They're just a locally owned little operation. 82nd has its reputation. They're tucked away a little bit.
How do you spell it?
Covert, Covert,
Like a
Okay.
spy
cafe.
over, yeah.
Just incredibly sweet people who make really good food. They do a lot of like local music. They do a local comedy night.
Wow.
They do like they did like a D&D thing that was just
Okay.
open. And they've been incredible, just incredibly open and supportive of the kinds of causes that I participate in.
Sure.
It's
So
really
yeah,
nice.
they've
Yeah,
been really great.
shout out to
Like them
them.
a lot.
I guess bastions and
Yeah.
breakfast or brunch.
Is that that's the gluten-free,
Yeah.
right?
Yeah.
Yeah, with my kids and I are very into their bread.
Oh, I
Weirdly.
love bread. I actually am fine with gluten, but
I
I
am
have a few
too.
friends who do not do it.
Okay.
But
Their
their
bread is
food and
weirdly
their bread
good.
is exceptional.
You're saying
Yeah.
their gluten-free bread is good.
Yeah.
Yeah.
But it's
Yeah.
just shocking to me because I am not gluten intolerant, and it's hard to find like a baked good that tastes halfway
Mhm.
decent without
Yeah.
gluten in it to me.
Yeah.
And their bread it really is oddly good.
Yeah.
One thing about it that I will say is you buy it in a loaf. This is a very Portland thing to me. They charge you $2 to slice it, and
Oh.
you bring it up to the counter, and then you wait for them to do
It's
that.
like a performance. You get to watch that.
Well,
Yeah.
if and when they get to it,
Oh, okay.
and then it's a busy place.
It's more of like a deli process.
You may need to remind them that it's Mac there, and then eventually you'll get it. But I choose to do that because I'd rather do that, pay the $2 and do that, than have my children like rip hunks out of it.
Sure, yeah.
Or just sit there and do
Yeah.
because I won't do it the way they do it. They just put it under a machine and go, and then it's
Oh,
done.
okay. I was
Yeah.
picturing more of a Salt Bay thing where it's like really
Oh no, they've got the machine, and it's very precise and nice
one-time
the way you
thing.
want it to be. If
Okay.
you want that sort of sandwich
think
bread,
They'd put some out that were sliced and some that weren't.
oh,
But,
then they
yeah.
wouldn't get my $2,
Yeah.
which I'm
That is
happy to give
funny.
them.
All right, cool. Yeah. I was just gonna plug, what's the best place is the website or the app to kind of
So I think the website is probably the website and the helpline are
Okay.
really the first kind of
the
best
first line
yeah.
point of contact, because the app, there'll be information there. But really that website is such a good place to start. alz.org.
Okay. Yeah, thank you so much for coming today. This was a
Thank you.
great
Yeah, thank
discussion.
you.
And
Thank
I
you
learned
both.
a lot.
Thanks for having us.
Yeah.